Okay, let's take a look at the next page where this is the last group of points on this fascial line, and they're called the three weights. And these are a really powerful group of points. I use these very frequently, and they're associated with the extensor digitorum longus muscles. So you can see in the image there that the extensor digitorum longus is highlighted in red, and these groups of points are right in that muscle there. Now, they're located between the stomach and gallbladder meridians, so we have knowledge of where the stomach and the gallbladder meridians are at, but these points are interesting because they're right in the middle of the two of them. And the way that we find them is that we go above the lateral malleolus, 3 sun, 5 sun, and 7 sun. So these points are 3, 5, and 7 sun above the lateral malleolus, and then 1 sun anterior. So that takes us out of the area of the gallbladder meridian, and then that puts us between the gallbladder and the stomach meridian. There's also a lot of interosseous membrane connecting the tibia and the fibula in this region, and it's most accessible from here. So if you needle deeply, you're able to get into that connective tissue, and I believe that this will have a stronger effect when treating certain types of conditions. So the indications that these points have are that they treat lateral neck pain, problems in the SCM or the scalene muscles, hyperthyroidism, facial paralysis, and conditions of the eyes, teeth, and mastitis. So by simply just following the anatomy up and keeping with this concept of imaging the ankles to the neck, here we find a group of points that are in the area of the ankles and just proximal to it that are treating the neck and conditions within this area, such as hyperthyroidism or problems in the scalene muscles or SCM. Now, I like to use these points for respiratory conditions, especially if it's a liver gallbladder pattern that's affecting the lungs and the breath. So like chi stagnation, where the client's like holding a lot of tension in their chest and in their neck, and they have difficulty breathing because they're very stressed and they have a liver stagnation pattern. These points are really good for that because it is able to release the tension in this distal area but affect these secondary respiratory muscles of the SCM and the scalenes. And then it'll also have an effect on the costal area. And so great group of points to use. They're also used for a lot of neurological conditions such as head concussions, meningitis, and brain tumors, and hemiplegia. These are traditional indications that they're used for. And because they're more distally located, we're going to have a stronger neurological response. So I think that's why these points are indicated for that. And then finally, the traditional indications are that they harmonize the liver, spleen, and stomach. They can be used for liver diseases, enlarged spleen, and spleen diseases. And in the sense of not only traditional patterns of liver and spleen disharmony, but also for Western disease diagnoses, you would use these points for as well. And we might ask, well, why could these points treat liver disease? Well, the liver does have a connection to the abdominal wall through the falciform ligament. And so there are these connective tissue associations that help hold the liver in place and connect it to the abdominal wall. And so this would provide a structural basis for why these points can influence the liver function, because when we release the tension from these points, then that's going to get translated through this fascial line and then up into the abdominal area, and then it can potentially send mechanical signals from the abdomen and through the falciform ligament and then affect the positioning and the structure and function of the liver both. The next point here reads, it enters the deeper fascia in the neck and the lateral line. And the reason I wrote that, and going back to our discussion of the neck, is that this is a junction point between the stomach and the gallbladder meridians. So the stomach and the gallbladder meridians, they start to converge in the area of the feet, but then they also do the same in the area of the neck. So the SCM is a part of this superficial front line, but the SCM is also part of the lateral line as well. So in both the area of the distal legs and this area of the extensor digitorum longus, we find a convergence of the gallbladder and stomach meridian coming together in the feet. And then we find something similar with the SCM as it attaches to the head, and the gallbladder meridian's relationship with the mastoid process in the area of GB20. Now, we'll be discussing the anatomy of this more when we talk about the lateral line, but for now, just keep in mind that the SCM muscle is both on the superficial front line and the lateral line, and so we see this anatomical basis in the neck that mirrors this relationship between the stomach and gallbladder meridian in the ankles as well. Now, I like this group of points for treating anterior shoulder pain, and much like the use of stomach 38 for treating shoulder pain, I find that these points will actually work better a lot of times, and I've had clients that wouldn't respond to acupuncture at stomach 38, but then when I did these points, they got better. So it's a great group of points for lateral and anterior shoulder pain, and I'll often needle that on the same side. I usually start on the same side as the shoulder problem, but then there will be cases where you'll want to needle that on the opposite side. And traditionally, from a balance method perspective, we would needle the points on the opposite side, but this is a group where I'll do the same side and the opposite side, and often I'll start on the same side. Okay, the next part here in the red box, it reads junction points. And understanding the junction points, or what we traditionally call the meeting points, it's really very insightful because we can learn a lot about the way the meridians cross over and meet and the way that the muscles do this, and we can learn a lot about the anatomy as well. So the head of the fibula is a junction point for both the lateral line and gallbladder meridian, and then the superficial front line and the stomach meridian. So we've got this extensor digitorum longus muscle attaching to the head of the fibula, but then we also think of this as the gallbladder meridian area. So again, we see this sort of crossing over effect with the gallbladder and stomach meridian at the head of the fibula. And then we've also spoke about the SCM and the lateral line, and how the superficial front line and the lateral line both contain the SCM, and then stomach 9 and stomach 12 are both meeting points for the stomach and gallbladder meridians. So stomach 9 is located in the neck, and then stomach 12 is located in the middle of the clavicle on the superior side of it. So stomach 9 and stomach 12 are meeting points for the stomach and gallbladder meridian, and we can understand how this relates to these fascial lines and how imaging the neck to the ankles, it corresponds with these points as well. So if you get problems in the area of stomach 9 or stomach 12 and you have clients complaining about problems here, then use these groups of points, and remember that they're also indicated for hyperthyroidism and problems of the SCM and scaling muscles. So really great group of points. And a lot of clients will have liver, spleen, and stomach disharmonies as well. And it's very common to see this in clinic, where maybe they're stressed or they've got a lot of anxiety or a typical sort of liver pattern, and then that's affecting their digestion. So clients that have stress and anxiety that's compounded with digestive problems, this is a good group of points to use for them as well. Okay, let's take a look at the next slide, and it reads 3 weights and the Chui Yin. So in the meridian systems, we find that the yang ming organs connect to the jui yin meridians of the pericardium and the liver, and the diagram at the bottom left side shows the jui yin yang ming connection. But then the xiao yang also connect to the jui yin. So you can see on the right side in the red box that the jui yin connect to both of these, and this is really important to remember because sometimes we can just use pericardium and liver points and address problems in the yang ming as well as in the xiao yang, and this is one way to reduce the number of points that you use when you understand these meridian systems. And let's just read what the text says here. It says, conditions of the head, neck, and face, such as migraines, neck pain, Bell's palsy, facial paralysis, TMJ, and eye disorders will often involve the stomach and gallbladder meridians. So for conditions that are affecting the head and the face and the neck, or Bell's palsy, facial paralysis, TMJ, eye conditions, it's not uncommon that if you're looking at what area is affected, that it will occur in both the gallbladder and stomach meridians. Like, this is very common to see when you're working with clients that have conditions in the head or the face, or if they have a neurological condition that's affecting the head or the face. It's not always easy deciding what the primary meridian is affected. You know, sometimes it looks like it's more in the gallbladder meridian, and then the patient starts explaining a bit more, and then it seems like it's more of a stomach meridian complaint. And we've got patterns like liver yang rising, which would be more of a xiao yang jui yin pattern. But then when you've got like liver yang rising with phlegm, we'll start to see more of the stomach and spleen patterns arise. So understanding that there's this relationship then with the jui yin and the yang ming and xiao yang meridians, it starts to make things a lot more easier. So I just want to read the rest of the text here. It says, additionally, in Zongfu theory, these are often identified as liver yang conditions, which may occur with phlegm. And from a meridian-based perspective, the jui yin connect with both the xiao yang and the yang ming. Well, when you see these types of patterns where it's a liver pattern, but it looks like it's affecting the xiao yang, but you may have problems in the gastrointestinal system as well, so the yang ming is affected. When you see these types of liver patterns which are manifesting symptoms in both the xiao yang and yang ming meridians and organs, then just use these points and keep it really simple, because they will address all of those types of things, whether it's a condition of the GI system or if it's something going on in the head, neck, or face, or the jaw. Use these 3 points for those types of things, and it makes these complex patterns super easy to treat. Okay, let's take a look at the next slide where we find common problems in the superficial front line. Now, this is going to look familiar to what we spoke about earlier with the superficial back line, because these two fascial planes are in opposite relationship to each other, so that when the superficial front line contracts forward, like you see in the image there, that's going to overstretch that super back line, like we talked about. Now, the common problems then are forward contraction due to excessive desk work, looking at phones. This is shifting the head forward and contracting the sternum as well as the abdominal muscles. We can see forward tilts in the head. This can also result in breath, chest, and rib tightness and contraction. People will also have anterior pelvic tilts and shifts where the pelvis is shifted or tilted forward. This can cause problems in the superficial front line and be related to some of the indications that we find with Master Tung's points on this channel. So let's see, we've got some other indications here: knee problems and hyperextension. Look out for this. This is something that you see somewhat regularly in clinic, where people are locking their knees out, and that's contracting the quadriceps there. And when you see this, know that the superficial front line is overly contracted. And this can have various implications. Sometimes you find people holding emotions in their quadriceps, and that can be related to digestive system dysfunction or emotional eating patterns or a variety of things. So it's really interesting to take into consideration the way that these fascial planes also relate to emotional holding patterns, and the quadriceps are a major area of that for some people, related often to the digestive system and eating patterns. This last point reads that the restriction in ankle movement for plantar flexion and dorsiflexion can be related to problems in the superficial front line. So plantar flexion is when you push your toes away from you, and dorsiflexion is when you pull the toes back towards your body. So if there's difficulty in movement of the toes forward and away from the body or towards the body when you pull them back, then that can indicate that there's some problem in the superficial front line, and that would likely indicate that there's something going on in the area of the three weights. Okay, to finish this section, I just want to conclude with some yoga poses that you can do to open up the superficial front line. So some of them here, generally back bends are beneficial for this because we're stretching the chest and the abdomen, but also any of the poses where we're stretching the quadriceps and extending them, like you see in the first picture there through the warrior, that's going to have a strong effect on working the quadricep muscles there. So some of the poses are upward dog, bow pose, lunges, and warrior poses. I really like these for strengthening the body, and when there's chi deficient type conditions, just doing some lunges and warrior poses can be very beneficial for strengthening people. The bridge pose is also a nice, really gentle move to do. I like this one for low back pain and when we need to open up that front channel. The bridge pose is somewhat related to needling points on the abdomen for back pain. So those points that we can needle on the lower abdomen for back pain, the reason those points work is because there's that contraction in the superficial front line. Well, by having someone do bridge pose, then that helps to open up and stretch that superficial front line in the abdomen, and then that counterbalances what's going on in the back. So for most cases of low back pain, and especially when I'm needling into the hands or the arms, I'll have people do the bridge pose because it's maintaining and restoring that balance between the superficial front line and the superficial back line. Now, a more advanced pose is Wild Thing. We won't discuss that because that's for more advanced yoga practices. Reclined Hero pose is a nice one. This one's fairly gentle and a good one to stretch the quadriceps. And the Wheel, another advanced yoga pose. So if you're into yoga, I encourage you to take what you're learning in this class and extend that into your yoga practice and your understanding of how the poses affect these fascial planes as well as Master Tung's points. So this concludes everything I want to say on this section for now. And in the next part, we'll be discussing the lateral line and starting to get into some of the arm lines as well.